is Dr. Charles Klodell, and I'm a thoracic and cardiovascular surgeon here at the Florida Heart and Lung Institute at North Florida Regional Medical Center. Welcome to the Weekly Heartbeat. This week, we're going to talk about some of the minimally invasive cardiac and thoracic procedures that lead to not only increased patient comfort, but enhanced recovery. For cardiac surgical conditions, when we talk of minimally invasive, we're talking about either open surgery through keyhole incisions or catheter-based approaches to valvular heart surgery. When we talk first about the open procedures, this is often the aortic or the mitral or even the tricuspid valve. And we can often do these through very small, almost keyhole-like incisions that are maybe 5 or 6 centimeters or smaller than the breadth of your hand. Through that, we're able to still see and access the valve, do the surgery, and allow the patient not only a smaller incision, but less surgical trauma and enhanced recovery. When we talk about valvular heart surgery, in patients who it's appropriate, even beyond the minimally invasive open surgical techniques, are catheter-based techniques. There are catheter-based techniques to include clipping of the mitral valve, as well as even catheter-based replacements for either the mitral valve or the aortic valve. We're fortunate to be one of only 50 centers in the country that has access to a clinical trial for implantation of a mitral valve through just a catheter. Minimally invasive thoracic procedures here at North Florida Regional Medical Center again spans a spectrum of procedures. At the very basic level, when we speak of thoracoscopy or VATS, V-A-T-S, video assisted thoracoscopic surgery, what we're talking about is inserting a very small camera through a Band-Aid sized incision to allow us to view the inside of the chest, and then through additional small Band-Aid incisions, insert instruments into the chest and perform the surgery. This can be on the lungs or lymph nodes or any of the contents of the chest. Then additionally here, we're fortunate to have access to surgical robotic technology. And through this, we can even change the articulation to where inside the chest we have more articulation than the human hand could ever allow. This allows us to do very precise movements and very fine and very safe surgical procedures. That's all we have for today. Thanks for joining us, and we'll see you for the next Heartbeat.